Good afternoon, everyone. If you please take your seats. We're about to continue our program here. I know I promised you all a quote from my mom, so here I go. She's a very wise woman. She has plenty, but one of my favorite is, barriga llena, corazón contento. So I hope you all enjoyed the food. It was good to hear the different discussions that were happening. And again, bridging gaps and getting to know one another is a big component of this summit. It is my honor now to welcome Tom Perez, Senior Advisor to the President. You know him in many different roles. He was Secretary of Labor. He worked as an Assistant Attorney General. But I think one of the things that is important to note, and something that you see in the way that he carries himself and the way he represents our communities and conversations, is that he is the proud son of Dominican Republic immigrants. And so without further ado, I'd like to welcome one of our own to the stage, Senior Advisor to the President, Tom Perez.
Hey, buenas tardes. What a great honor to be back here. Wow. I have been having Old Homes Day with about half the audience here, so it's great to be back. Had the privilege over 20 years ago of working in this building when Donna Shalala was the Secretary of Health and Human Services, and worked with many of you. I was just talking to Lourdes Rivera about, oh my God, Guadalupe, man, you still got hair. I don't have hair. You know, you got hair. Dadgummit. I remember working on the executive order on language access in 2000 with you and with so many others in this room, including the leader to your left. Thank you again for being back. Great seeing you again. We were just talking out in the hall. Folks, this is, and I also want to acknowledge, I think she'll be speaking shortly, the chair of the CHC, Congresswoman Barragan from California, is in the house, and I'm so excited that she will be here as well. I think it's really important in life, and I always say this to my kids, to understand the moment of time in which we sit. This is a moment of remarkable struggle. Our democracy is on fire, and it's a five-alarm blaze. And at the same time, it's important to remember that this is a moment of tremendous opportunity. If you look at the social compact of the 20th century, the most impactful things we did as a nation were done at moments of incredible peril in our nation. You look at the New Deal and what we accomplished there in the depths of the Great Depression and a world war. You look at the civil rights struggle of the 60s, and you think about it. The Civil Rights Act of 64, the Voting Rights Act of 65, the Fair Housing Act of 68, our civil rights infrastructure, which has helped so many people of color get access to basic fairness, was built during those moments. And we're in another one of these moments. And the reason I bring it up is if we don't recognize the moment of opportunity that we are in, we will squander that opportunity. And Joe Biden, as a student of history, and Kamala Harris, as a student of history, understand the moment in time that we are in. And when you reflect on what has been done, and I really want to say thank you to Secretary Becerra, to Marvin Figueroa, wherever he is, and to everybody here at HHS. I worked with a lot of folks here, and I worked with many partners on the outside here. Thank you for what you did then. And thank you to President Biden for what we're doing now. Because you think about this, we're in the beginning of Hispanic Heritage Month. It's a moment of reflection. It's a moment of renewal, and it's a call to action, reflecting on what we've accomplished, but equally, if not more importantly, committing to the unfinished business, committing to the implementation of what we have done. And when I think about what we have been able to accomplish so far in this moment of grave peril to our democracy. And by the way, Thursday of this week, President Biden will be speaking on this issue out in Arizona. A really important speech, something to listen to. But I look at where we are right now as a community, and you look at the job creation. You know, I used to work right across the mall here at the Labor Department. Two of the ugliest buildings in town, right on the mall. Now, I know if someone from HUD were here, they'd say, but what about us? We're equally ugly. True, it's a dead heat. Jack Kemp once said, never been in a building where every floor was modeled after the basement. Not making that up. But folks, we have made so much progress. You look at the Latino unemployment rate. When President Biden became president, the Latino unemployment rate was over 8%. Now it's 4%. You look at the labor force participation rate of Latinos, and we are at some of the highest levels ever. You look at so many other things we have done. And I want to say thank you to Secretary Becerra, the wonderful people here at HHS. We've been working so hard and so successfully to make health care affordable. As a result, Latinos have seen a 53% jump in enrollment rates after the administration lowered insurance premiums. That's a big deal, folks, the Inflation Reduction Act. You look at the 10 prescription drugs that are listed, you look at the illnesses that disproportionately affect black and brown communities, and those are the 10 drugs. And that's not even counting insulin, $35 a month. That's a big deal. And moving forward in so many other areas, the investments in the 988 suicide and crisis lifeline. I know you talked a lot about behavioral health today. My daughter is an MSW student at NYU. Her student placement last year was in a school that was 98% Latino. Many kids who arrived literally days or weeks before, making a harrowing journey from their country of origin. And she told me about the trauma that her students experienced. And what I love about my daughter is she understood that these are kids who have all the talents that they have, but they haven't had the opportunity. And that's why the Suicide and Crisis Lifeline is so important. That's why the investments in building out a community mental health infrastructure under this administration are so critically important. We can do this, folks. And you know what else we need to do? We need to do immigration reform. Because if we want to help Latinos at scale, we've got to move them out of the underground economy. And that's the reality of the moment for so many people. We know that there are still disparities that persist, and I won't get into all of them because you've been living them, you've been studying them, you've been working to eliminate them. And that is indeed the unfinished business. And it's not only an economic imperative and a healthcare imperative, it's a moral imperative moving forward. And that's why I know you already talked earlier about Medicaid redeterminations. Critically important. One of my calls this afternoon will be with the governor of Minnesota talking about what they're doing there. Because this is a whole of government enterprise. We, as a result of the leadership of Barack Obama and Joe Biden with the Affordable Care Act and then the subsequent work of President Biden, we are making tremendous progress in reducing the ranks of the uninsured. But we know now, after the expiration of Title 42, we've got to make sure that every single eligible person is enrolled. And we know that there are some who have graduated out of Medicaid. And that's great. They have a job. Or they're on the ACA. That's great. But we also know that red tape and other barriers, especially in a couple states that'll go unnamed, Texas, are making it a lot harder for folks to enroll. And we've got to address that. And the community-based organizations within our midst are so important because you are that trusted leader in the communities. I'm acutely aware having done a lot of work at the grassroots level, that when you show up in certain communities and say, hola, me llamo Tomás Pérez, yo soy del gobierno, estoy aquí para ayudarle, they're like, I don't know about that. And I get that. And that's why we're all in this together. And as I look around, I see, again, opportunity, but I do see some dark clouds. I'm looking at that poster right over there, WIC shopping. Why do I look at that poster? Within 2 days of a shutdown, there will be no WIC program available. Bless you. Bless all of you. There will be no WIC program available if we shut down. And people don't have a safety net. They can't go to their bank account because their bank account doesn't have a lot of money, if any, in it. And so when I think about the unfinished business, we need your help. Not only with Medicaid enrollment, but we need your help in persuading the far right of the Republican Party to come to their senses. Because this is real. I just got off the phone with the governor of Hawaii. The only city in the country you can visit all 5 branches of the military is in Honolulu. And you know what? They're going to work for free during the shutdown. That's not fair and that's not right. So will our Border Patrol agents along the border and elsewhere. That's not right. That's not fair. And that affects everyone. So we need your help. And I'm confident as I come to you again, remember the moment. We have tremendous opportunity. We have tremendous unfinished business. We have tremendous partners. I am like Joe Biden. I come to you with an unrelenting optimism. And it's an optimism informed by the fact that there are people in this room that have been working on these issues. In some cases, don't know why I keep looking back at the two of you, for literally decades. And I know that working together, government working with our private sector partners and our business partners and our local and state government partners, working together to build an America where everybody has opportunity. And if you don't have health care access, you don't have opportunity. Let's continue this momentum. Let's seize this moment. Let's continue to succeed. Thank you so much for having me, and let's get to work together. Adelante.
Wow, that was incredible energy. One more round of applause for Secretary Perez. Now, please help me welcome Lourdes Rivera. She's the president of Pregnancy Justice for our keynote address. Lourdes.
Buenas tardes. I'm so honored to be part of this Hispanic Health Summit hosted by the Department of Health and Human Services, and as well as to follow Tom Perez, who has been such a long-term champion of the Latino community. And I'm really grateful for Secretary Becerra's role as the first Latino leader of HHS. Leadership and representation matter to the health and lives of our communities. I'm Lourdes Rivera. I'm president of Pregnancy Justice, and I've dedicated my career to health advocacy and reproductive rights and justice. This is because the history of my community and the women and people of color in this country has been about the resilience in the face of laws and policies that are fueled by stigma, stereotypes, and discrimination. I do this work in the name of my abuela Carmen, who was born less than 2 decades after slavery was abolished to a family that worked on a sugar plantation in Arroyo, Puerto Rico. Abuela was tough. My grandmother outlived my grandfather for over 50 years, but she had very little agency about her own childbearing. She had 14 pregnancies and gave birth to 10 children. Abuela was left to care for her family with much hardship. And of course, I love my extended family. You pick on one of us, you pick on all of us. But I just can't help thinking about what my grandmother's life would have been had she been able to make her own decisions. My parents migrated from Puerto Rico to New York right after World War II. This was a time of Operation Bootstrap that was the push to industrialize the island of Puerto Rico away from an agrarian economy. The government encouraged outward migration, hence my parents, And they targeted controlling women's fertility as a means of reaching economic and social goals. And I grew up in Brooklyn, New York, from the mid-'60s to the early '80s. It coincided with the so-called war on drugs that had disastrous effects in my Bed-Stuy neighborhood. I remember women in hushed voices talking about la operación, the operation. This was so common that 1/3 of my mother's generation was sterilized, some by complete hysterectomy and often without informed consent or medical need. From a documentary called La Operación, I learned that this was a policy carried out in Puerto Rico and in New York. And a central figure was Dr. Helen Rodriguez-Rias, a pediatrician from Puerto Rico who worked in the Bronx and fought to stop this practice. She co-founded the Committee for Abortion Rights and Against Sterilization Abuse and became the first Latina president of the American Public Health Association. She championed informed consent protections for women in Medicaid that still are in effect today. And I also learned about the birth control trials of the 1950s conducted on the bodies of Puerto Rican women as guinea pigs. While women wanted a way to avoid and space their pregnancies, those targeted for the trial were poor and lacked education. They were not told that they were test subjects. They were not afforded informed consent. And experimentation and coerced sterilization were not unique to Puerto Rican women. The backdrop of this also included the U.S. eugenics movement that succeeded in passing forced sterilization laws in over 30 states. Involuntary sterilization was so common for Black women in the South that civil rights leader Fannie Lou Hamer dubbed it the Mississippi appendectomy. Mexican American Chicana women were targeted in California, as were Native American women seeking services from Indian Health Services, as were other marginalized groups. And this is not just a story of the past. Shockingly, between 2005 and 2013, 144 incarcerated women in California, the majority identified either Mexican or Hispanic, were sterilized. And immigrant women held in a Georgia detention facility just a couple of years ago experienced unnecessary gynecological procedures. And after almost 50 years, there is no longer a national right to abortion with the overturning of Roe v. Wade. When Roe was decided in 1973, it was the first time in the world that a court held that abortion was guaranteed under its Constitution. But as Dr. Martin Luther King Jr. once said, the arc of the moral universe is long, but it bends towards justice. And I would add that the arc is not linear, with progress and setbacks and sometimes at the same time. First, while Roe established the right to abortion nationwide, it also became a ceiling rather than a floor. Right after the decision, lawmakers started chipping away at access. In 1976, the Supreme Court upheld a national restriction imposed by the Hyde Amendment, named after Congressman Henry Hyde, who wanted to bar abortion for all, but noted that his only means at the time was restricting access for poor women in Medicaid. The first woman known to have died under the Hyde Amendment was a young mother in Texas named Rosie Jimenez. She crossed the border to Mexico because she couldn't afford to pay for abortion where she lived. Rosie was 27 years old. And over the years, the Hyde Amendment was expanded broadly across federal funding programs, limiting access for people with limited means. And in 1992, Planned Parenthood versus Casey, while upholding the core holding of Roe that abortion was legal before viability, it also weakened the legal standard, allowing state regulations from the beginning of pregnancy and not just in the third trimester, as long as they did not constitute an undue burden. This opened the door to countless restrictions and legal challenges like the amusement park game Whack-A-Mole, with the states adopting hundreds of unnecessary protections, even as many were blocked by courts. A web of unnecessary, burdensome rules blocked access for people seeking care and worked to shut down clinics. And abortion restrictions have had an outsized impact on Latinas. Data analysis by the Kaiser Family Foundation shows that Latinas need and use abortion services at a higher rate than white women. And a UCLA Latino public UCLA Latino Policy and Politics Institute study found that even before Roe was overturned, almost half, 5.1 million of the Latina population ages 18 to 44 reside and are rapidly increasing in the 29 states that restricted reproductive rights. They concluded that the harmful impacts of overturning Roe are likely to disproportionately affect Latinas, who will face increased burdens and the need to travel to access care. And let's not forget that in a place like Texas, travel means crossing border immigration checkpoints. And the landmark Turnaway study documented health, safety, financial, education, and other life consequences, including being stuck with a violent partner for people who cannot access wanted abortion care. And what also gets lost in the politicized debates about abortion is the stark biological fact that pregnancy, while it goes well most of the time, has undeniable risks to life and limb. The U.S. maternal mortality rate is rising for every group. It is especially in outrage for Black women, and the rate for Hispanic women surpassed that of white women for the first time in 2021. And we anticipate this picture to become worse in the aftermath of the Dobbs decision. And Dobbs, a wrongly decided opinion, which I don't think will last the test of time, the majority Supreme Court decision looked back into the 1800s before women could vote, and literally to the 1200s to determine what rights we should have today. And even as it looked back to the 1800s, the court undertook a selective read of history and tradition, ignoring the extensive evidence in the record. And the court's analysis was so alarming that the Organization of American Historians and the American Historical Association publicly criticized the court for failing to meet high standards of historical scholarship. And now, people in need of abortion are facing a complicated morass of state laws across the country. Abortion bans are currently operating in 21 states, including 14 with a ban in almost all circumstances. But on the plus side, there are 24 states in the District of Columbia where abortion is legal, with new protections in 20 states because of the hard work of advocates and policymakers. But let's be clear, the Dobbs decision represents a retrogression of rights, which is out of step with the global trend of liberalizing abortion rights, expanding access, with Colombia and Mexico being the latest example. With medication abortion, which has mitigated this, but it's also under attack. But we're seeing the dire consequences of people in banned states not getting appropriate obstetrics care, and doctors are fleeing states, leaving abortion deserts. But the threat of criminalization is very much beyond abortion. Pregnancy Justice has been defending pregnant people who have been criminalized for a long time and has documented cases of criminalization of pregnancy since 1973. We just published new research to understand the scope and trend of criminalization leading up to the overturning of Roe. And we found that in the 16 and a half years before Dobbs, pregnant people have been criminalized at an accelerating rate, with almost 1,400 criminal cases taking place between 2006 and June 2022. And this is triple the number in half the time as compared to our last study. We found that geography and income level are the greatest risk factors for being criminalized. Nearly 4 in 5 arrests took place in these 5 southern states where the Latina population ages 18 to 44 is growing. And these are states that are among those with the worst maternal and infant health outcomes. Over 8 in 10 people arrested were determined by the court to not be able to afford necessities and be able to qualify for a public defender. The mass majority of cases involve allegations of substance use as a basis to criminalize pregnant people, even when there is no harm to the fetus or infant, and with the vast majority resulting in live births with no health problems. And while substance use is highly stigmatized, the medical evidence and consensus among all of the major medical professional organizations is that criminalization worsens maternal, fetal, and infant health. It delays access to prenatal care and substance use treatment. So what's fueling this acceleration? There are two colliding drivers. The first is the expansion of the extreme ideology of fetal personhood, the idea that fetuses and fertilized eggs have the same, if not more, rights than the person carrying the pregnancy. It started getting traction in the past 25 years and was used to gut abortion rights and has increasingly been embedded in state laws and judicial decisions. Roe was an imperfect stopgap for pregnancy criminalization, but Dobbs has opened the doors for states to advance this ideology, and 15 states have broad fetal personhood laws that have yet to be fully realized. And the second driver is the opioid and methamphetamine drug crisis. And as a society, as we've come to have greater understanding of substance use and mental health as a mental health and public health issue, but not for people who are pregnant. The same cynical, punitive approaches that are targeted Black and brown communities by the war on drugs are being wielded against pregnant people based on gender stereotypes and substance use stigma. And this opens the door to criminalizing any actions deemed harmful to fetuses. Any miscarriage or stillbirth, which is common in the best of circumstances, can be a crime, could be a crime scene to be investigated. And all of these are reproductive wrongs, from forced procreation on one side to denial of procreation on the other, and everything in between. And what we need is reproductive justice. Reproductive justice is not just a substitute for choice. It's a framework first articulated by Black women in the 1990s. It's a U.S. expression of human rights and centering the experiences of Black women. The framework has also been adopted by Latina reproductive justice groups here in the country because this is our experience too. Reproductive justice is defined as the right, dignity, resources, and respect to not only not have a child, but also to have a child, to raise our children in safe and sustainable environments in which they can thrive. And more recently, adding birthing justice in response to the maternal mortality crisis. And this prioritized not just abortion rights, but access and calling for comprehensive health care and addressing issues like forced sterilization and other issues. And while we've made tremendous progress that we've heard about today, there is much more that needs to be done. And this summit is an important opportunity to shine the light and prioritize bodily autonomy and reproductive justice for Latinas and Latinx people, including those who are pregnant. We need to make comprehensive health and reproductive health care more accessible. By passing laws like the HEAL Act that would eliminate barriers for immigrants. We need to eliminate the Hyde Amendment to expand Medicaid, including 12 months postpartum in all states. And we should work to reverse the continuous denial of bodily autonomy of women and people of color and the people with the capacity of pregnancy. So in addition to providing criminal defense, pregnancy justice documents and opposes criminalization through our Pregnancy Prosecutions Tracking Project. We're calling on law enforcement and healthcare providers to heed the scientific evidence and medical consensus that criminalization harms maternal and infant health. And we need to include pregnant people in anti-drug criminalization efforts and divorce criminalization from the points of healthcare access, including with stronger HIPAA protections. And yes, we need to reject dangerous fetal personhood laws and restore abortion rights, state by state, and by the adoption of the Women's Health Protection Act. And we know that the vast majority of Americans are with us. And to conclude, the challenge before us is not by just to overturn Dobbs to reinstate Roe. We need to aspire for more. Our collective work has to result in meaningful change for people who experience the most discrimination and disparities so that people like my abuela Carmen and countless others can make their own decisions.
Thank you, President Rivera, for reminding us of the importance of reproductive justice and birthing justice as well. I have the distinct honor of welcoming Chair Barragan. She's a champion for maternal mental health, for women's health, for immigration, and most importantly for our community. With that, I'd like to bring Chair Barragan to the stage.
Well, good afternoon. Thank you for having me here today. I was just mentioning, I think this is my first time in the HHS building, so it's great to be here. My name is Congressmember Nanette Barragan. I am chair of the Congressional Hispanic Caucus, and proud to say the chair of our largest ever caucus at 42 members strong, the largest caucus in history. It's an honor to be here today to celebrate Hispanic Heritage Month and to continue the conversation about Latinas and healthcare, which is something I personally care about, not just because I'm a Latina and a woman, but because of my very own situation at home with my mother, who's 82 with Alzheimer's. But I'd like to also give a shout out to one of our partners, our former colleague, CHU's very own Secretary Javier Becerra, who's been wonderful here at the Department of Health and Human Services for hosting this first ever HHS Health Summit. It's a testament to the concept and the idea of how representation matters and who is at the decision-making table matters. Secretary Becerra has been a steadfast partner in CHC's work to improve health care for our Latino communities ever since he served in his 12 years in Congress and now as the first Latino to hold the office of Secretary of the Department of Health and Human Services in history. I think that deserves a round of applause. Now, one of the things that you're going to hear from our panel today, of course, is Latina and healthcare, and I just want to touch a little bit about why healthcare for Latinas is so very, very important. I don't know about you or your family, but I know I've heard a lot in Latino cultures and in our family. It's our moms in our families who are the patriarch of the family. They keep the family going. They take care of us. They make sure we're on time. They give us the support that we need. And sometimes that means mom's a homemaker and she stays home. It other times means that mom is a powerful entrepreneurial person or a CEO or even a member of Congress, right? But it's the importance of having health care for Latinas to make sure that we take care of them just like they take care of us and to make sure that we're keeping our households running. But the reality is, of course, there is a huge disparity within nuestra comunidad, and it runs deep. And it's that disparity in access to care. I mentioned my mom, who's 82 and has Alzheimer's. Even I have a problem navigating our healthcare system for her. And I'm a member of Congress. I can only think and wonder about the Latinas who are not members of Congress or who don't have somebody that they know they could call to figure out how to navigate the healthcare system. And these disparities are significant. You know, statistics show that Latinas have a higher mortality rate than non-Latinas from things like cervical and breast cancer. And Latinos are less likely to receive regular pap smears and pap tests, and they face mental health challenges at higher rates than their peers. And I don't know about you, but in my family, mental health issues were not something you ever spoke about. Latinos also have a high uninsured rate. It's at 18%. And it reminds me of when I was a kid. We went to a community health center and a clinic to get our vaccines. And that was our access to health care. Well, for many, a doctor's visit can mean the choice between getting care or keeping the lights on at home. And while these statistics and realities seem daunting, as chair of the CHC, I commit and promise to you that we are fighting to make sure that we close that gap on disparities in care, that we are working closely with HHS and our secretary here to make sure that we're doing everything that we can to overcome these systematic inequalities that continue to disproportionately impact Latinas. Last month, the Hispanic Caucus worked together with the Tri-Caucus in a letter to Secretary Becerra, asking him to please get involved, to hold states accountable because of the unwinding that we were seeing of people coming off of Medicaid. And as we know, that is hugely impacting Latino families and Latinas. And I'm proud that the Secretary took our meeting, heeded the call, and that HHS acted quickly and restored Medicaid for 500,000 children and families, right? These are people who are disproportionately people of color. Their Medicaid was restored, and many more hopefully will be protected going forward. But that's how the work of those here at HHS. So those of you who work here, thank you. Those of you who are in the industry working to do what you can to make sure that Latinas have access to care, thank you. It is partners like you that will help close this disparity. I couldn't help, as I was waiting to speak, to hear what Lourdes at Pregnancy Justice was talking about reproductive women's rights. And of course we know Latinas are on the front line. Latinas are going to be hurt by this, and they are already being hurt by this. Just a little over a year ago, the Dobbs decision, as you know, took away one of our constitutional rights, the ability for us women to make our own health care decisions. And today, over 6.5 million Latinas now live in states that either has banned or is likely to ban abortion. That's the largest group of women of color impacted. They're Latinas. And the consequences of these bans go far beyond the right to choose, because we're seeing even women being denied access to medications that treat things like cancer, even when they aren't pregnant. And for those with us today, we know that this is just another barrier to health care that far too many Latinas experience. Now, thankfully, the Biden-Harris administration is doing everything they can to fight back, but it's up to Congress and it's up to us to act. And we have to continue to fight to make sure that we are giving women access to full range of reproductive health care options, including contraception and safe legal abortion. And in Congress, that means a bill called the Women's Health Protection Act, and making sure we're fighting to get that done. And finally, I want to talk a little bit about gender-based violence. And I want to first start by thanking the Biden-Harris administration for its work to combat gender-based violence. Now, we know that gender-based violence can impact anybody. It's not just a lower income. It's not just people who maybe didn't go to college. It's at every level. And we know, according to the CBC, that approximately 1 in 3 Latinas experience domestic or sexual violence at least once in their lifetime. And we know many additional cases go unreported due to cultural, realistic, linguistic, or economic barriers. Now, thankfully, Congress passed the Violence Against Women Act, Reauthorization Act, and the President signed it into law, and we're grateful for that. But even this is becoming more partisan. Things that were generally bipartisan are becoming more partisan, which is where we have to keep up the fight. And of course, earlier this year, the White House released the first ever U.S. national plan to end gender-based violence. And since then, the administration has distributed record funding for programs aimed at preventing gender-based violence, improving law enforcement responses, and increasing culturally specific resources and support for Latina survivors. Now, each subsequent reauthorization of the Violence Against Women Act continues to significantly improve safety and support for all survivors and increase prevention efforts and inspire change that will ensure all people are able to live free from violence. And I'm going to continue to work hard in Congress through the Hispanic Caucus and in my personal office to make sure that we're working with our partners to doing everything we can to improve lives for our Latino communities, increase access to health care for Latinas, and to end the gender-based violence that we're seeing in our communities. There is a lot of work to do, and I'm calling on all of you to reach out and partner with us, partner with the Hispanic Caucus and members of Congress so that we can work together to make sure our voices are heard and we're strong and that we are at the forefront of leading the effort. fighting for Latinas and Latinas in healthcare. And with that, I'm looking forward to hearing from this panel, and thank you all for your undivided attention. I hope you have a great afternoon. Gracias.
What an incredible champion. Thank you so much, Chair Barragan, for your words and for all you do and all you will do in Congress. Now we'll turn to Mayra Macias, Executive Director of Building Back Together, who will lead the discussion. She will be joined by an incredible panelist. We have Melanie Fontes Rayner, Director of the Office of Civil Rights. We have Dr. Catherine Cloutier, Office of Violence Prevention. We have Dr. Celina Sandoval, Fellow Physician for Reproductive Health. Mayra, I'll turn it over to you.
All right, I know you're ready. We're saving the best for last. As Marvin said, my name is Mayra Macias. I'm the Executive Director of Building Back Together. We are a nonprofit organization that was created when the Biden-Harris administration took office to really help pass the Biden-Harris agenda and to explain what it is and how it impacts our communities. So I am honored to be amongst this distinguished panel of amazing Latinas. The panel is titled Latinas to the Front, Conversation about the State of Women's Health, and you'll hear from 3 experts in the fields of reproductive justice, gender-based violence, women who fought to ensure that Latinas have access to health care through the Affordable Care Act. But before I introduce our panel, I did want to share a quick anecdote and why I'm excited for this conversation. As many folks probably experience at some point in their teenage years, I was without health insurance. And I remember one time in college feeling immense pain on my side, going to the gynecologist, and being told that it was either gas or an ovarian cyst. And that in order for me to find out, I had to undergo really expensive tests. And immediately, knowing that I didn't have the money, I said no. And before I could leave the doctor's office, the doctor wrote a note basically outlining the risk that I was taking by leaving without taking those tests and abdicating responsibility, as she should have. But I remember thinking that it wasn't an option to spend that money. And how many Latinas go throughout their lives foregoing medical care because they don't have the money. And women on this panel did everything they could to make sure that we're increasing access to health care. I shouldn't have been surprised that years later I found out that Latinos have the highest rate of uninsurance. And even though under the Biden-Harris administration and under Secretary Becerra, we have closed that gap, 1 million more Latinos have been registered under the Affordable Care Act and all of the different ways through the Inflation Reduction Act. There is still a lot of work to do. And so this group of ladies right here, they're doing the work. I'm grateful for them. There's so much work to be done. So with that, I'm going to introduce our panel. First up, we have Melanie Fontes Rayner, the Director of the Office of Civil Rights at the U.S. Department of Health and Human Services, where she leads the department's enforcement of federal civil rights and privacy laws and directs related policy and strategic initiatives. Give a round of applause to Director Fontes Rayner. In her power pink suit, let's go. Next up, we have Dr. Catherine Cloutier, who is a senior program specialist at the Office of Family Violence Prevention and Services. A round of applause for Dr. Cloutier. And Dr. Celina Sandoval, who is a fellow at the Physicians for Reproductive Health, where she advocates for reproductive justice, including equitable access to abortion care and contraception. So, yes, round of applause. Sorry, I'm skipping you over here. To begin, I'd love to start off with Dr. Fontes, or Director Fontes Rayner. I'm giving you a doctorate already.
I have a JD.
And just something that I'm often amazed at is just like, what brings you to this work? What is your why? And so you all have done such incredible work and are doing incredible work. What brings you to this work?
Yeah, so thank you for the question, and exciting to be here. So if you've heard me speak before, you've heard me talk about my mom. My mom, I got a little emotional just if it even started. Sorry.
It's going to
be a great panel. So I was raised by, my mom is a single mom, and she raised not one but 2 lawyers. Some of you know my sister who used to work at this agency. And it was not easy. And my sister is like another parent to me. And, that meant sometimes somebody wasn't advocating for me at school, right? Like I graduated with really good grades, but no one was telling my mom, like I could go to a good school. So I went to University of Arizona, which is a fantastic school, but like other doors might have been open, right? And I didn't have that knowledge. I didn't know that. And I think I have had experiences like that across my life. And so for me, it's about being that person for somebody else, fighting for other people. I mean, I've had this experience. I'm sure many of you have had it. You know, my Nana was in the hospital a couple of years ago, and I was asking questions. What is this medicine? Why does she have to take it? When is she taking it? When is she going home? And for my family, my aunts and uncles were mortified, right? Because they thought that I was being rude to the doctor. They thought I was, being too aggressive. And, you know, I think that is very prevalent in many communities. And so I want to be that voice for those communities. And I want to use my seat at the table and my office and the work that we do to fight for people. You can clap now.
Thank you. Dr. Coutier.
Yeah, thank you so much for inviting me today. Apologies in advance. I am a very last-minute stand-in, but I will do my best. I would just say that, so I'm with the Office of Family Violence Prevention and Services with ACF, the Administration for Children and Families, and gender-based violence is just a topic that has always been very close to my heart. So I've been here in DC for almost 3 years now. Was living outside of the country for about 10 years prior to that, and just feeling very lucky to be in this position, and very honored to be up on stage with everyone today.
Thank you, Dr. Cloutier. Round of applause. And Dr. Sandoval.
So I'm Selena Sandoval. I'm a fellow with the Physicians for Reproductive Health. I'm an OBGYN, and I do full-time abortion care.
And thank you. Yes. Thank you.
I grew up in California, so more of a liberal kind of community area. I moved to the Midwest for my medical training, and that is where I saw a significant increase in the rates of restrictions around reproductive health. I myself, as a medical student, had trouble even accessing the contraceptive method that I felt was best for me. I went through residency, continued to see how these rates of restrictions affected abortion access, and really decided to dedicate my life to reproductive justice and increasing access, specifically in the Midwest and the South.
Thank you. And actually, yes, round of applause. The next question's for you. Before we dig into the policy, I would love for you to give us some context. What are the health issues impacting Latinas today?
So when I think about the key health issues that are impacting Latinas, I think a lot about lack of access to insurance, economic barriers like poverty, the wage gap. I think about gender-based violence a lot, and the rising maternal mortality rate. But I think the important thing to think about is that all of these factors compound upon each other, and they really affect the overall health of our communities. And we see this a lot in reproductive health as well, including access to abortion. Something I think about a lot with the lack of insurance coverage is we know that not having access to insurance means that sometimes you can't afford the care that you know, even if you know it's what is best to get. And so this can make our chronic conditions worsen. This might make patients less likely to seek health care for preventative services. We think about like pap smears and cervical cancer. But the disparities in care, we know that Latina women and girls are actually 3 times more likely than white non-Hispanic women not to have insurance. And that's especially affects our reproductive health care, including abortion care. So for states that aren't using state funds specifically to cover abortion, the discriminatory Hyde Amendment prevents federal funds to be used for these patients. And so that lack of insurance coverage can really make abortion inaccessible for patients. And so that can be the difference between continuing a pregnancy or accessing the safe abortion that our patients are looking for. When I think about gender-based violence, we obviously know that there's a disparity here. About 1 in 3 Latinas will experience gender-based violence during their lifetime. There was a recent study looking at pregnant Latinas and found that in this particular study, 10% of pregnant patients reported physical violence from their intimate partner during their pregnancies. Another key factor of gender-based violence is reproductive coercion, which I know was talked about earlier today. So for those who don't know, reproductive coercion is any effort to control or manipulate somebody's reproductive choices and reproductive autonomy. So that could be things like their contraceptive methods or their access to abortion care. Not surprisingly, when we can look at rates of intimate partner violence and reproductive coercion specifically, they are obviously tied to rates of increased unintended pregnancy. And so why this is particularly troublesome is our rising maternal morbidity and mortality rates in the United States. So we know that women of color have significantly higher morbidity rates and complication rates from their pregnancies than white women. We know that this is regardless of their insurance status, their age, their education level. This is a systemic issue specifically. So when we think about all these things, the other thing I think about a lot is patients that we see. So the vast majority of people are going to have a nice, normal, healthy pregnancy, but we know that pregnancy can exacerbate and often does cause new complications or new health conditions. I see patients regularly who are facing complications in their pregnancy or have in previous pregnancies. Very recently, I saw a Latina woman actually from Texas. I provide care in Kansas, so she came to us all the way from Texas. She had had a recent pregnancy about a year before, and during that pregnancy, she was actually diagnosed with pregnancy-induced heart failure. As everyone probably put together, that's a very serious condition. She was able to deliver safely, but was appropriately counseled by her doctors at that time that another pregnancy would be very unsafe for her, would likely worsen her heart failure, and could threaten her life. So she was doing her best to recover. She was using contraception, but as we know, contraception can fail when her and her partner experienced a new pregnancy. But she knew right away that this was not safe for her. This was not a viable option. She knew what was best for her and her family. And so she was able to get an appointment with us, and she underwent an uncomplicated, very safe abortion with us, and was able to return to her family. But even with all the barriers she was facing and the travel she was facing, she's still one of the very few and lucky patients that was actually able to make it to us to undergo care. And so we know that the Supreme Court's decision in Dobbs has wreaked complete havoc on the abortion landscape for patients. There are 21 states that either have a complete ban or severe restrictions on abortion access. And so this has caused patients to be completely displaced from their community when seeking health care. And these are patients that are already facing barriers like cost of the procedure, cost of travel, having childcare someone to look after their family while they're traveling 2 states away to get an abortion. And so really, I think some of the biggest factors when we think about what's affecting Latina health is the kind of litany of barriers that are placed on our patients and what's worsening their health care.
And thank you for all the work that you do. And as you mentioned, just access to health and reproductive health in general, I think about the abortion bans in several states that are highly Latino states and what that means for Latinas who do have access to health care but can't access it in their states. I want to pivot over to Dr. Cloutier and Director Fontes Rayner. Just based on what Dr. Sandoval said are some of the main issues impacting Latinas and their access to health care. Can you talk a little bit about what the Biden-Harris administration has done to increase access and mitigate some of these issues?
Yeah, so I want to start, if you look around the walls of this room, it doesn't look like this country. And the representation the leadership starts at the top, right? And the first thing that President Biden did was he put Secretary Becerra at the top of this department as the first Mexican-American secretary, and we're very proud of that. And in that work, right, we've taken steps we talked about increasing access to coverage. We talked about making healthcare more affordable. In the reproductive health space, right, we're really focused on what does it mean, what does the lack of Roe, like the fall of Roe, mean for your healthcare, right? Understanding that the federal law itself has a lot of restrictions. And so what does it mean for emergency medical care, right? We put up guidance that says you have a right to emergency medical care, and that emergency medical care can be stabilizing care, which can be abortion. And that guidance was done in conjunction and when working with physicians across the country, because the stories that we're hearing now, we were hearing 2 years ago in Texas when Texas started first started passing its very restrictive law, right? Women being told, go sit in your car and bleed out more. Women being told, you're not far enough along, I can't help you. Women being told, I can't tell you where to go. These are real things that are happening across the country. I've been in 13 of the banned abortion states. These are not made up stories. These are things that people have shared with me, providers have shared with me. And so we're focused really on what does it mean? Just because you live in a state that has banned healthcare does not mean that you don't have rights. So understanding that federal civil rights laws continue to protect you on the basis of race, ethnicity, age, disability, sex, which can be your pregnancy status, making sure that folks understand that. We've done work with pharmacies to make sure that the pharmacies like CVS and Walgreens have phone numbers that you can call so that if you have a delay in a prescription, you can get help. Training for their staff so that their staffs understand they're not the arbitrator of what the state law says, and that there's places and protocol in place to help patients get access to care, right? We saw a lot of people go to pharmacies post the Dobbs decision, and they weren't seeking care for abortion. Not that there's anything wrong with that, but these women literally were getting prescriptions they had been getting for a very long time for disabilities, rheumatoid arthritis, right? Methotrexate treats that. And they were being denied and delayed these prescriptions. And so we worked with CVS and Walgreens, and we came up with a settlement agreement that helps put in protection places for those people, right? We've also worked on things like increasing access to birth control, right? The Center for Medicare and Medicaid Services, grants for community health care clinics, making sure that we're focusing on privacy, right? We can think a lot about like the information that you keep on your phone, right? How many of you shop, go to doctor's appointments? I mean, you do everything on your phone, right? In addition to like Instagram or TikTok or whatever generation you're from, right? I mean, it's true, right? I don't use TikTok, but I use Instagram and I see the videos later. I just dated myself. But, right, understanding and taking into effect, don't store protected health information on your devices, making sure that you're using end-to-end encryption, potentially reconsidering whether you download an application if it's free, understanding that there might not be security in place. We have a lot of focus on this. My laws that I regulate don't cover every single application on your phone. The other agencies in the federal government also don't cover everything on your phone. So really it's taking that privacy into your own hands and then working with providers to make sure that providers are educated and understand, right, that the law does not require you to use and disclose data. The only requirement under HIPAA is that when there's a large breach, like a data breach, that is disclosed to the Secretary of the United States at HHS. Other than that, those are permissible disclosures. There's some discretion. So we put out guidance to try to educate providers about that, right? And at the direction of President Biden, right? President Biden has not done 1, 2, but 3 executive orders on reproductive health space. That's unprecedented. That's a commitment to this space.
Thank you. Dr. Cloutier, anything to add?
Yeah, I would just add, so through the Biden-Harris administration, the Office of Family Violence Prevention and Services received American Rescue Plan funding. So our funding goes to state agencies, tribal nations, and state domestic violence coalitions, as well as national resource centers and capacity building centers. And so one of our national resource centers is really focused on domestic and family violence within Latino communities. And so some of our ARP funding is specifically looking at that intersection of domestic and family violence and health within the context of COVID-19. And so our National Resource Center, focused on Latino communities, they've been doing really amazing things with that funding. And they've also been partnering with our newly funded, culturally specific sexual assault capacity building center, and they're doing a lot of great work with them as well at that intersection.
Thank you. So it's clear there are a ton of resources. There's a ton of work that's been done in the last 2 years under this administration, but yet there's still barriers for Latinas accessing these resources. Dr. Sandoval, you see patients every day. Can you talk a little bit about some of the cultural barriers you see that inhibit some of the Latina patients from accessing resources?
Yeah, of course. So I think the first one, which is probably the most obvious, is a language barrier. So a lot of patients are hesitant to see a provider that may not speak their language. They may be concerned that they're not going to be understood. So it's really important that we have adequate bilingual staff. It's important that we have adequate translation services that are culturally competent as well, and that we're really centering our care in our communities. And the language barrier affects patients in multiple realms that we often don't think of. So in Kansas, for example, we have a required 24-hour consent that the patients must sign. And so this is a state-mandated form. It's medically inaccurate, and it's a huge barrier to all patients, but to specifically our non-English speaking patients. We have a lovely patient navigation team that attempts over the phone to explain the form, how they have to have it printed. It has to be printed in certain colored ink, things like this. It has to be signed in an appropriate way. It has to be dated in an appropriate way. And despite our best efforts, this is not done a lot of the time. And so we see this with our English, but also more prominently our non-English speaking patients. And so if we have a patient that presents without the correct forms and the correct paperworks, and they're required to reschedule. And so frequently we attempt to help them fund like a hotel room overnight if we're open the next day. But the barriers we talked about previously, like funds to be away from work, childcare, things like that. So the language barrier really comes into play in many kind of facets of the healthcare system. Specifically in the repro health world, we think about lack of access to information, primarily from a language barrier. And so we hear from Latina communities a lot that they just aren't aware of what's available to them. And so thinking about like medication abortion, for example, there's been a lot of litigation around medication abortion, specifically looking at mifepristone. That's that first pill that you take for a medication abortion. And so a lot of Latina communities just aren't aware that this is still an option for them. And we see that kind of tie in with contraception options as well. Additionally, kind of familial and community pressure, we see this a lot. And so something that is well understood is that a lot of Latina patients use familial expertise or stories and experiences from their family as one of the main factors. One of the main factors when they're making important healthcare decisions. And so a lot of this comes up with contraception, for example. We have studies talking to patients about what is the most important key factor when they're deciding what they want to use for themselves for contraception. And the most common answer is, someone in my family or a close friend of mine had this experience with this method, and for that reason I either will not be using it or I will be using it. But when we think about abortion care, where there's a lot of stigma around abortion care, and a lot of this is prominent in the Latina communities. Obviously, this isn't a monolith. There are a lot of Latina and a lot of leaders in the Latina community who do support abortion access, but there's a lot of shame and stigma around that. And so when we take away a patient's ability to talk to their family about their healthcare decision, that can create a lot of internal conflict for that patient because it's something that they so heavily relied on previously. The other thing we think about is feeling that threat of surveillance. And so even, presenting for most healthcare kind of feels like an access point where you could be detained, for example, if you're undocumented. A lot of healthcare services, including my clinic, for example, requires a form of legal ID. And so patients may be confused about what ID they can present with and concerned that that might be an access point to be detained. Additionally, when we think about traveling out of state, we know some states, such as Texas, have physical checkpoints now that are preventing patients from traveling, especially our undocumented patients. So all of these things, and even though there are a lot of cultural barriers to care, we also have this really beautiful history of community-based care in the Latina community. So the Latinas and indigenous communities have a long-standing history of reproductive health in a community care setting, so helping each other through miscarriage management, birth care, and also abortion care. And so especially with the increased access of mifepristone and misoprostol, we know self-managed abortion is actually very safe. And the greatest threat to our patients when it comes to self-managed abortion is actually the threat of criminalization.
And that's a great segue, thinking about community care, to some of the work that both of you have done with community agencies. We know that it is not of value for us to talk about all of the great resources and access to healthcare if we're not getting it down to people. And so I'm curious, Director Fontes-Reyner and Dr. Cloutier, if you can just talk a little bit about community organizations that you've worked with, either at the state level or federal level, who are helping get this information down to people.
Yeah, so I run a national civil rights office. We have offices in 11 cities across the country. My job is unique to other federal civil rights offices in that not only do I do federal civil rights laws, we are also the agency charged with your health information privacy under HIPAA. And as we have healthcare that is banned, right? Forget about what kind of healthcare it is, banned, just banned healthcare. We're seeing more and more targeting of data. And to our panel's earlier comments, right? I think we think about how do people get information, right? I think about my mom and my tias in Phoenix and whether or not something would make it to them in Phoenix. And oftentimes the answer to that question is no. They wouldn't make it to my website. My website is a very old-looking website. It's functional. It's accessible, but it's not something flashy. It's not something that we don't have a budget for commercials, right? And so we're really, really reliant upon partnering with local organizations and local community groups. So because President Biden had an executive order, that executive order directed HHS to do convenings to talk about federal laws and compliance. We've done, as I said before, convenings in 13 states of 21 banned abortion states. In each of those, we've done one conversation around reproductive health care. In each conversation, we typically will visit a clinic. We've been to many Planned Parenthoods around the country. We also, in those conversations, have met with lawyers, advocates, patients. And again, the stories that we hear, I'm not making these things up, right? I have talked to doctors in Texas who tell me, even my patients that want to stay pregnant, I tell them to leave the state when they get to their last trimester because it is not safe here and I cannot help them, right? I've talked to doctors who say, hey, can HHS do something more in privacy because law enforcement are showing up at our door in uniform, they don't even have subpoenas, and they're going on fishing expedition to track women and to track doctors. And that's why we've done a lot of guidances. We have a proposed rule. We're working on this, but I think it's an area that folks don't really think about, right? You're being tracked in a way that other populations aren't being tracked. And so we really rely heavily on local organizations, whether it's reproductive justice organizations, whether it's organizations like the ACLU or Southern Poverty Law Center, to both disseminate the kinds of information we put together. We tried to put together a lot of fact sheets, I did a YouTube video in Spanish on our disability rule a couple weeks ago. We're trying to do more of that in the HIPAA space because, again, there's a deficit of information for people right now. And if you don't know your rights, how the heck are you going to get your health care and how the heck are you going to stay safe? And so we really rely on that. When I was in Los Angeles, we met with promotoras. We were trying to do as much downstream meetings with folks. If there are folks in the room who think, hey, I wouldn't mind putting together a toolkit, or I wouldn't mind working with that office, right? The gist of my office is that we can investigate the law, right? Law enforcement. And so we have a complaint hotline. We have a complaint website. And so getting that information out to community so that people can file those complaints. And again, you don't have to file the complaint yourself. Like, let's say you're scared or you just don't want to undergo that. Somebody or an organization can do it on your behalf, because odds are if it's happening to you or if it's happening in your community, it might be happening somewhere else. And so we really, really try to partner with all kinds of organizations and also the bigger parts of HHS like CMS or ACF or HRSA, because again, we are really reliant upon, building upon their size and their resources to try to educate people as much as possible.
Thank you. Dr. Cloutier?
Yeah, so as I mentioned before, we have two culturally specific capacity building centers that we work with at OFIPS, Office of Family Violence Prevention and Services. So one of them is Esperanza United, and they are our culturally specific capacity building center around family violence and domestic violence. And then more recently, we started working with Las Mujeres Latinas en Acción, and they are, based in Chicago, our new culturally specific sexual assault capacity building center. And so, and then together, they are also working with a very specific ARP funding stream where they've essentially partnered and are administering those ARP dollars out to local programs across the country and in Puerto Rico. And those are local programs that are implementing DV and SA, domestic violence and sexual assault programming. And these are local programs that perhaps have been overlooked by, I suppose, mainstream funding or other federal funding opportunities. And so this is just like a very, very exciting area of the OFIPS work going on right now. The first week of October, Esperanza and Las Mujeres are coming together with our other culturally specific resource centers who are also administering similar funds. And they are bringing together all of their subrecipients. So I think there's going to be perhaps over 300 people in attendance. And they are going to be doing a really incredible peer-to-peer convening that first week of October. So again, just bringing together a number of different local DV and SA programs that are focused on culturally specific programming. So that is just one area that we are very, very excited about. And then, of course, Esperanza and Las Mujeres, they're just doing incredible work as well, just as individual agencies. A lot of work around language access. I know Esperanza has an incredible language access toolkit. And then going beyond that, really looking at developing different tools and resources for bilingual advocates, community health workers, community leaders, and Mujeres right now, they're working on a very significant amount of different listening sessions across the country and in Puerto Rico as well, again, with community health workers and individuals to really dig deep on building the capacity across local programs to better serve Latino families and communities.
That is incredible. Before I pivot to my last question, we do have an opportunity for the audience to ask questions. There should be Post-it notes on the tables. So if you do have a question, write it down. Someone from the HHS team will come and pick them up. Now, I would not be a good organizer if I didn't ask you all to leave us with the one thing. We have a room full of folks who have eyes and ears all over the country. As you all said, there's so much work that has been done. There's so much work to be done to close the insurance gap, to close the access gap. And it is obviously critical when we're thinking about reproductive justice, but it's not only reproductive justice, right? It's healthcare overall. I was talking to my father about one of the provisions of the Inflation Reduction Act, which is diabetes insulin being capped at $35 a month. And he was shocked. He had no idea that that was happening. Shingles vaccines are now free. I was talking to a colleague who talked about how his mom couldn't afford the $500 to get a shingles vaccine. There is so much work that has already taken place to make access to healthcare affordable and accessible, and we need to spread the word because, again, there's no use for all of this work to be happening if people cannot access it. So what is the one thing that you would tell folks that they should leave with doing here, whether it's accessing any of the programs? I know, sorry, just catching them off guard. This wasn't part of the prep. And then Dr. Sandoval, what would you say is the one thing that folks should share as those of us who talk to our families about our healthcare decisions? What's like the one piece of advice that you would impart to this group?
Say abortion. Normalize talking about abortion, write about abortion, share abortion information on your social media, fight the stigma around abortion care.
That's a good one. I think I didn't even say abortion, so thank you. Thank you.
So I would say, we are in this together, right? And you don't have to have a sister or an aunt or a mom to give a crap about this topic. Sorry, I'm so sorry.
Family space.
It's fine. We'll edit it out, right? Right? Like you don't have to have that, right? And I think we're in it together. So it's in our community, it's in our family, and it's our culture. And we empower each other by giving each other information, by working together to get to community. We know that Latino communities aren't reached the same. We're not, people keep saying we're not a monolith or a mosaic, right? And that is true for how we access healthcare, where we live, what kind of healthcare we access, who we are. And so we are in this together. So juntos.
Thank you.
Goodness.
No pressure.
No pressure at all. Yeah, I think that just the simple idea of everyone leading with empathy and just understanding how unique everyone's experiences are and everyone's situations are and having those difficult conversations, but more so normalizing them and, just leading with that empathy and offering people and families and communities, space that they can feel safe and empowered in.
And I'm getting the questions. Thank you. All right. Okay, so hold on. So our first question is around immigration. So we talked a little bit about the barriers for immigrant communities. Can you all talk about what are some of the barriers and things that this group can do to make access to health care for immigrants more equitable and accessible and safe? And I don't know, Dr. Sandoval, if you want to share anything of what you've seen are best practices in treating immigrant communities.
I think just offering care with a lot of empathy and being aware of kind of the fears and barriers that the patients are facing already and not contributing to those barriers and fears. And so, offering reassurance that we're not required to report anything specific in our healthcare, beyond obviously our mandated reported things like abuse. But letting them know, like, we're not going to share this information with anybody. This is a safe space to communicate with you. We do have multilingual staff. We're here to support you, and let your community know that this is a safe place to get care.
Thank you. And Director Fontes Reyner?
Yeah, I mean, it is the law, right? It's the law. This is not a best practice. It's not a nice to have. It is the law that you have healthcare, health and human services that is accessible to you both culturally and in your language, right? Limited English proficiency. And it is 2023. My office continues to get complaints where services are not being provided in Spanish, right? And I'm not saying, like, Spanish is, like, a lot of people speak Spanish, right? There's a lot of translators. There's a lot of resources in this across the country. But if you're not getting if you're not getting things in Spanish, you're certainly not getting other indigenous languages or other languages that could make that life or death situation, this difficult conversation about someone's health care, that level of care that you're talking about, and dramatically can improve health outcomes. And so that's the law. And so we continue to have challenges that we continue to enforce the law. We just did an agreement with Maricopa County a couple months ago, literally over their child welfare services and use of Spanish language and interpretation. Maricopa County is the biggest county in Arizona. Arizona is a growing Latino population. So they were not interpreting things in Spanish. They're fixing that, thank goodness. But I just want to tell people that is the law. And we should be following it. And if you think that you're seeing things, you should be reaching out to our office. And if there are ways we can partner with other organizations to improve that accessibility, it's a department-wide priority. It's something, if you've heard Secretary Becerra talk about, you've heard him talk about, that it's 2023 and you still can't have health care in a way that is both culturally and linguistically available to community.
Thank you. Dr. Coutier, anything to add?
Just because I'm the program specialist that is very lucky to work with Esperanza and Las Mujeres, I would just say go check out their work. They do really, really great stuff around breaking down those barriers and working with organizations to better address those barriers, become more contextually and culturally informed, and just to provide better support to that community. So check out their websites, and you won't be disappointed.
And because I promised to be on time, we're going to close it up to final remarks. So one, just thank you for your expertise. Thank you for the work that you all do to make sure that we're increasing access to health care for Latinas. Thank you for pushing us to say abortion, for protecting our civil rights, for partnering with grassroots organizations. What are any final thoughts you want to leave with this group of people? This is a final panel. Folks have been here all day. What is like the fire that we're going to leave with to make sure that we're continuing to do this work?
I am a Mexican American. I'm a fifth-generation Arizonan. And I try to say that as much as possible because I think there's an East Coast bias out here sometimes, and we don't talk about our people enough. I'm serious. So I just want to sort of, this is Hispanic Heritage Month. This panel is to talk about these really important events and what's happening, but it's also to recognize our culture, our community, and our families. And it's really important to me in the work that I get to do. My mom grew up my mom grew up in Phoenix in the 50s and the 60s, which was like terrible, right? Her family had to sit in the basement of the Catholic Church when they went to Mass. One generation away, her kid runs a national civil rights office, and my goodness, if that's not progress, and we're celebrating a little fire in your belly, then I think there's a lot of work to do. I think we can do it together, and I'm really proud to be here with you today.
Wow.
Yeah,
you got it. You got
it. There's no way. But I just, thank you again for having me. Thank you for your patience. Again, I was very last minute stand-in, and it's been a pleasure. So thank you.
And Dr. Coutier, who is amazing, did us a solid by coming in. We had Director Rosie Hidalgo, who is the first woman to lead the office. I'm gonna butcher it. What is the Office of Violence Against Women in the Department of Justice? Incredible. So thank you for joining us. And also, we should be celebrating Director Hidalgo because That is a huge accomplishment, going back to your point about representation. When we're at the table, we're pushing for decisions to be made in the favor of our community. So thank you. And last but not least,
if I can just add, Director Hidalgo was previously with Esperanza United. So just again, plugging them out there for you.
We'll let her know that we send her all of the love. And thank you for joining us. And Dr. Sandoval, you who are in the trenches, working directly with patients, you see it, and you're in the front lines, and thank you. What are you leaving us with?
I just want to thank everyone for being here and including us in this conversation, and I really want to encourage everyone, when you go back to your communities, to continue to reach out to your reproductive justice organizations and including them in platforms like this.
Amazing. Well, thank you all. We hope you learned a lot. Please approach these ladies for questions, for partnerships. There is a lot of work to do. 1 million people, 1 million Latinos access health care under the Biden-Harris administration, and there are still many more that need access. There's still folks who are suffering from abortion bans all over the country. So we need to do everything we can to make sure that we are spreading the word on what is available. Thank you all for being with us, and happy Hispanic Heritage Month.
All right, y'all, we're almost there. We're going to do a 2-minute break, and the secretary is headed back down to sign some partnerships that we have established with public-private partners to further the work of HHS. So, les doy 2 minutos. So I'm giving you guys 2-3 minutes, stretch out a little bit before we start the program again.
Produced by the U.S. Department of Health and Human Services.